Let me know if you need any help renaming yourself, if you want to put back on there or anything. Morning, everyone.
Good morning.
This is an issue, and if you are one of those people, be really careful. Hi, everyone. While we're waiting for Kathy to join, folks could begin putting your name, what organization you're from, and whether you're a MAC member, a BAC member, or any other reason for joining in the chat. We're going to be trying out a new form of introductions. And so we'll be starting with the chat and then a little later in the agenda, moving to meet and greet breakout rooms again. So feel free to start populating the chat.
Good morning. Sorry about that. I am Kathy Coming-W. I'm chair of the MaineCare Advisory Committee. Let's give folks another like 30 seconds to join, since I know, based from some emails, that a couple people forgot they needed to register. So let's give them a little bit more time to do that. And I'll say this again in a minute, but I also just wanted to note that we're going to make a little change to the agenda. Because Michelle Probert has an unexpected conflict for most of the meeting today. So I'm just looking to see if she's on yet. I don't see her yet, but we're gonna start with updates from MaineCare and then do our breakout meet and greets like we did in July. But again, for folks just joining, I'm just giving folks another little bit of time because I know that a few folks forgot they needed to register. And everyone is welcome to put their, I see some folks already doing this, to put their name and pronouns, organization, or why they're here in the chat. Because because we're not going to do the full group introductions today. And again, for folks just joining, I'm just giving folks a minute to get on because of the new need to register. Hopefully you can't hear it, but my cat is playing with this kind of noisy toy in the background. So my apologies if you can hear it. Okay, good. Kayla, I don't see Michelle. Is that right?
Yeah, she should be coming any moment.
Okay. Well, for folks who are just joining us, I'll just say one more time that we were giving people a little extra time to get on today because we know some folks forgot that they needed to register in order to get the new link. And also, I mentioned this, but we're going to switch from the agenda slightly because Michelle Probert has an unexpected conflict today. So she's going to be joining us any minute, and we're going to kick off with the main care updates, and then we'll go back to the rest of the agenda as written. And also, you are welcome to put your introduction information in the chat. We are not going to do whole group introductions today. And especially for those of you who are formal MAC members or alternates, if you can make sure your name gets in there so that Lisa can capture you for the attendance, that would be great. You know what, Kayla, while we're waiting, do you want to just take a minute to let folks know that the BAC has formally chosen representatives for the MAC and who they are?
Yeah, why don't I do the back updates now? We can do just a little more agenda shuffling. Why not?
Thanks.
If that sounds good. The back, and normally these updates will be given by Sana Osman, our member engagement manager. I know this is my second meeting now where I'm giving these updates, but Sana should be with us for our next one. She left me some updates to share though. The back had their second meeting on August 5th. It was another very introductory meeting. CAHK, Consumers for Affordable Healthcare, joined us and did an education session. So some background into MaineCare, kind of like a MaineCare 101, which was great. And we also have selected the BAC members that will be official MAC members. So they will be joining every meeting, if not most meetings, and will be added to the formal membership list on the website, which hasn't been updated yet, but is in the process. And the members of the BAC who are joining us on the MAC are Anita Tavanian, Miriam Bashir, Mitch Boucher, Rachel Ward, Rhonda Vosmus, and Wanda Martin. And I know I see some of their faces right now. If you all want to wave, feel free to wave. And you can find their names in the chat from our introduction. And some of you will get a little more one-on-one introduction in the meet and greet breakout room. Anita, did you want to add something, or were you waving? Sorry.
Just waving.
Okay. Some other updates from the BAC. They are currently reviewing our mainecare.gov website. So at our next meeting, we'll get some feedback from them about the content, accessibility, navigation, in the hopes that we'll be able to improve that website for users, making it more user-friendly. The BAC is also going to be using a short survey to identify topics for future meetings, agenda items. We also invite anyone to use a survey that's now on the website. It is on our MAC webpage on the right-hand
Hi there.
side.
I am calling because I understand that the Rustic
Rachel, we have
Agency on Aging has
We
a
have you not on mute. Okay, there we go. On the right-hand side in a call-out box, there's a survey, and then also on our Beneficiary Advisory Council webpage, there's a survey so that other folks can request that the BAC talk about certain things. So we're trying that out as a new way to generate topics from folks outside of these two groups. So we encourage you please to share that link with people you work with. If you work with MAME Care members, feel free to share it with them, community members, and for our MAC members to use that link as well to put forward ideas for the back agenda items. So that's something new we're trying out. We'll see how that goes. And lastly, our next back meeting is going to be on October 7th. And there are a couple of topics planned for that meeting. We'll have members of OFI joining, and then also plan to discuss the Katie Beckett program and a project that's going on to improve some user materials for that program. Yes, I'll put the link right in the chat, actually, Kathy. Thanks for that chat. I'll get a link to the page where you can find the survey and a direct link to the survey into the chat for you all.
Any
And that-
questions for
Yeah,
Kayla?
thanks, Kathy.
Kayla, I dropped those links into the chat, so go ahead and take a peek, everybody.
Thanks, Kat.
Welcome, folks. For those who just joined, my name is Kathy Kilrain Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director at Maine Equal Justice, but I'm also chair of the MAC. And we got a little bit of a delayed start today because we knew folks needed a little extra time because we switched the Zoom link, and that always causes some challenges for folks on the first meeting after that. And then also we are switching around the agenda slightly. We just did some updates from the back, and now we're going to pass it over to Michelle Probert because she had an unexpected conflict today, so she can't stay for most of the meeting. So we're going to do our meet and greets after the main care updates. And welcome, Michelle, and I'm going to pass it over to you.
Morning. Thank you. Apologies for the confusion this morning, and I literally just joined, so also need to make sure I have pulled up what I need in front of me. My name is Michelle Probert, Main Care Director. I use she, her pronouns, and thanks for being here this morning. Let's see. I will note that so we'll be discussing today communications around HR1, also known as budget reconciliation, also known as the Big Beautiful Bill during a breakout session. But I did want to let folks know that the department has been in the process of assessing what we need for resources in order to implement the requirements of the bill. So that's an ongoing conversation. I also will just flag that we are working across the department and with the governor's office. For those who may not be aware, there is a provision of the law that creates a rural health transformation program, and we are soon planning to communicate our plan to engage with interested parties on that proposal, and so more information will be coming soon on that front. It's an opportunity for all states with a quick turnaround. There has not been anything issued formally at this point outside of the language in the law itself, but we do know that the expectation is for a NOFO or an application really to be issued mid this month, with a turnaround for mid-November, and decisions need to be made by the end of this calendar year. And I will also just note, said this in other venues as well, but it's interesting with HR1, obviously we're all concerned about potential impact, but what I try to remind myself and our team at Main Care, and will say to all of you as well, is that the biggest impacts from this bill are around disenrollment. But that is an area where we as a department and you all as partners and advocates and members do very much have the ability to influence what that impact looks like. And so making sure that all of us and all of our members really have the best information is going to be critical, because I think from my perspective, one of the biggest risks of these changes is that people assume that they will no longer be able to receive a benefit without recognizing what all the exceptions are and what the requirements are. And so I just want all of us to remain hopeful in that there is a lot that we can do in terms of outreach and communications and education that absolutely have the ability and the promise to be able to lessen the impact on the folks that we serve. Okay, I also did want to provide an update. We have spoken on a completely different topic. We have spoken previously about the requirement for the Centers for Medicare and Medicaid Services that prescribing providers need to be enrolled in Medicaid for Medicaid programs to be able to reimburse for those prescriptions. We had indicated that our deadline was going to be September 1st, and that after that point, we would start to deny claims. We are extending that deadline. We have seen good progress recently in more providers enrolling so that this will not be an issue, but we are still not quite where we feel like we need to be, and we do not want there to be unintended consequences on member access to medication on this front. I will say that we're working hard to be able to turn on this requirement because it is important that we are following these federal regulations. Back to HR 1 again, there is heightened risk, I will say, when we are not making payments in alignment with federal regulation, that we could end up owing significant dollars back to the federal government that we cannot afford to do. So it's definitely a priority for us to continue progress on this front. Okay, so with those updates, I am.
Sorry, there's a question in the chat from Sarah Lewis. What is the NOFO, N-O-F-O, that may be released mid-September?
Yep, trying to remember. Notice of funding opportunity, and that is for the Rural Health Transformation Program, which was a provision under HR 1 that enables. I don't have the specific stats in front of me, but I want to say $100 billion to go across 50 states for rural health transformation activities, and states have to apply and meet certain requirements. So that is the NOFO that I was referencing. And that is that opportunity. We are going to be having engagement with interested parties and the public, and we'll be releasing the details of that engagement soon. All right, I am happy to introduce Megan Scott today. Megan, my apologies, I'm going to have you state your own title because I haven't memorized it, but Megan is new to the MaineCare team. She came to us from Maine CDC and is helping us today talk through the legislation that is coming out of the last session. Megan, go ahead.
Okay, thank you, Michelle. So yeah, Megan Scott, I use she, her pronouns, and I am the legislative and reform coordinator in the policy unit. And I think I'm starting week 7, so still pretty new. But one of the things I've done so far is kind of try to dig into some of the legislation that the office was following and try to identify where we have some things to do. So just wanted to give you all really a high level today. It looks like, Office of Main Care Services monitored over 100 bills this past session and was the lead on 61 of those, and then provided testimony or letters on 41. So a lot to follow from last session, but a few that I wanted to highlight for you today. So LD 93, it was an act to reduce costs and increase access to disease prevention by expanding the Universal Childhood Immunization Program. I probably won't read all the titles because I know we don't have a lot of time, but that one essentially changed the childhood immunization program to universal. So now all individuals in Maine will have access to vaccines. And then there was LD 167, which is going to be providing 2 hearing aids to Maine Care members now. And that we're supposed to start that reimbursement by July 1st of 2026. And the eligibility requirement will be just based only on severity of hearing loss now. Prior, there was a few other requirements that are no longer there. LD 865, that one will require Maine Care to reimburse for lactation services in the homes of eligible persons. So that's going to require, a lot of, rate determination, rate studies, state plan amendments, all those things, so that we can start providing lactation services. And those can be provided by a licensed healthcare professional or by someone that's nationally certified in lactation consulting or counseling. LD 1497 was an act to improve perinatal care through expanded access to doula services. That one also, I think, is another big one. It directs the department to begin a rate determination process for doula services and to also establish a doula council. And it does align with the transforming maternal health work that the department is, or the office is doing, and with that implementation timeframe as well. The LD 960 that allows the placement of hospitalized patients in nursing home facilities that are greater than 60 miles from their residence. There's a few conditions also that need to be considered with that, and I'm happy to provide more details if anyone is interested. But that one will require us to amend Chapter 101, Section 67 to allow that. LD 63, that one was a one-time transfer of funds to continue the Certified Community Behavioral Health Clinic project, so that it's the state share of that, so that we can continue that work that's happening under those CCBHCs, which is really great. LD 1687 was an act to clarify and increase access to HIV prevention medications. So that one gets into the pharmacists as providers issue. And it requires the department to create and implement a reimbursement model so that pharmacists can prescribe, dispense, and administer HIV prevention drugs. Yes, I can share a link to the summary for sure. And there's a couple other bills that required participation from OMS and work groups. One was strengthening primary care services, and another one was looking at services for children who need skilled medical care. And so, as those groups meet, and if there's any, things that come out of that would be interesting to this group, we'll make sure to include those in some of the topical breakout sessions. Quite a few others that resulted in reports and things like that, but those were the high level ones that I thought in just a couple minutes I could highlight for you all. Is there any questions? That I can try to answer?
I'm not seeing any, but really appreciate that overview. Thank you, Megan.
Sure.
Oh, Sarah.
Well, I have a question, but it's not for Megan, and I just wasn't sure when the appropriate time to ask is, but now that I'm here and talking, I'm just gonna go for it. It's actually for Michelle, or anybody else, but I just have a question about the interplay between Medicare Part D and when main care is the secondary payer. Um, so do your computer systems indicate when an individual has coverage under both Medicare and main care? Is my first part. Do you have access to that information? Or is it only if somebody's getting Quimby or something?
So first, I'll flag that I am probably not the person who's going to have precise answers to your
Fair
question,
enough.
Sarah. But I believe we are able to see when members have access to Medicare.
I'll just ask my general question, and if it's not anybody on screen, then just point me in the right direction. But basically, the question is, if an individual submits a claim to Medicare and it's denied, is there something that automatically triggers it to go to main care, or does the individual have to provide notice of denial, or do they have to do anything in order to move it along, or is it done automatically?
Michelle, I can take that.
Thank you.
Thanks, Heidi.
Sarah, yes. So Medicare has a fiscal intermediary that forces that over to main care. So if a claim goes to Medicare, the fiscal intermediary transmits that to main care and it processes the claim. So if it's a service that main care covers, we would pay the claim depending on the eligibility coverage for the member. So do you have a specific example you would like to talk about? We can do an
Yeah, I
example
mean,
as well.
actually,
So
yeah, I mean, the
Yep.
example is that an individual, and they may have gone about this wrong, so, but the individual required nutritional supplements that are covered under main care.
Mhm.
So the claim was submitted to main care, and main care kept denying it.
Mhm.
When in actuality, what main care needed was notice of denial by Medicare, because main care was secondary. And I'm just wondering what the trigger is to let the individual know that they need to get the Medicare denial first before main care will cover it.
Yeah. We'll also look at the member's eligibility too. So there's a couple different scenarios that may trigger that. I'm happy to talk with you offline, Sarah. We could look at it a little
Sounds
bit more.
great. Yeah,
Okay.
that's great. We'll do
Um,
that. Thank you.
Okay, great. Thanks.
Heidi, and you may not be the right person to do this in the future, but I think at some point in the future, it might be helpful to have a brief overview about how Medicaid interacts with Medicare or with other insurances, because I know this question has come up for issues in the dental subcommittee as well, and I'm sure it comes up for others on this call, and I think a lot of people are confused. So let's flag that as something that we can
Sure.
maybe do a quick overview of in the future.
Happy to. Thanks, Kathy.
Thank you. Michelle, is there anything else that you want to share?
I do not have anything for today. So at a subsequent meeting, we can also give a summary of the budget items that passed, but we were not able to go through that list today.
Thank you. And Rachel?
Good morning, everybody. Much like Sarah, I have a main care related question, and I'm not sure who best to answer it or when to bring it up in the meeting. But it's related to asylum seekers who might and eligibility for FIP. So I'm not sure when or who might want to address this question, or I could even take it offline if someone wants to answer it somewhere else, and maybe Kathy, you can share the answer. Whatever works best for today's meeting. So
Yeah, I think given that probably most people on the call don't know about FIP, maybe we could take it offline, or you could put your question in the chat and we can make sure.
absolutely.
someone
I'm
can
not
give an
sure.
answer.
I'm not sure
Just 'cause
who
we have
wants
such a
to.
full meeting.
Yeah, totally. But you know how these questions are, when you have
Yeah.
people who might be able to answer it, you want to jump on it. So
Yeah.
whoever wants to reach out to me, and it might be the best person to answer that question. just I don't know, reach out to me directly in the chat or whatever, and then I'll get back. We'll communicate, and then Kathy, whatever the answer is, I'll share it with you so you can share it.
Great. Thank you so much, Rachel.
Yeah, of course.
Okay, well, with that, we're going to go back to our original agenda. I know we're a little bit behind, but we'll catch up. And do our we got feedback from the surveys after our meeting in July that people appreciated the chance to connect with folks a little bit more. So we're gonna do a 10-minute breakout where you get to know each other a little bit more. And Kayla, I'll let you open those.
Thanks, Kathy. And I can put in the chat the questions that we had just to keep the conversation moving. And we were thinking for folks to try to limit each like round robin to about 2 minutes to make sure everyone gets a chance. But we'll also do a 2-minute warning before we close the group. And let's see, we're gonna do just random breakouts today. And those should be open for you now.
You want me to join one of those, Kayla?
That's totally up to you.
We'll give folks another second to get back. I think maybe we've got most folks back now. Welcome back. Hopefully it was nice to connect with people a little more. A reminder that we do have the survey at the end of this meeting, so that's a great chance too to make sure you remember the topics you had for future topical breakouts or agenda items for the MAC as a whole, and put them in the survey so we can capture those for the future. And now we're going to go to the Office of Family Independence, OFI, and I think I saw Ian here. Yep, Ian Yaffe, for updates from that department.
Cool. Morning. Nice to see everyone. I'll try to keep things fairly brief today for OFI and just see if there's questions that folks have. As a reminder, OFI manages all of the eligibility and enrollment related functions for MaineCare. So whenever you have eligibility and enrollment related questions, you would call OFI, not member services for those items. And speaking of phone calls, one of the updates that I have is that we changed the way that our call center works on August 11th. And previously, if you were calling OFI, you would, it's the same phone number, first of all. So previously, if you called that number, you would typically transfer to a member of our clerical staff who would then sometimes be able to help you or sometimes need to transfer you to an eligibility specialist. We had options for people that had questions about MaineCare or long-term care to transfer out to those specialized teams outside of the clerical process, but most people went through a clerical agent before moving into the final place that they needed to be for their phone call to be answered. And we changed that model to now have a menu that people choose from, and then you land at the place that you need to be to get your calls answered or your questions answered the first time without talking to anybody else. And so for the main care only calls for people that don't have SNAP or TANF, this isn't really changing much of what you do. But for people that have SNAP or TANF, who we generally can't ever, there's like almost no clerical SNAP or TANF questions. We generally have to transfer all of those calls. It means that now you'll be able to reach an eligibility specialist first, without having to go through somebody else and tell your story or have to verify your identity and those types of steps. There also have been longstanding challenges for SNAP and TANF related questions, in particular for people that had to, if we got to a point where the wait times were too long, we would tell you to try again another day, which people usually did not like to hear. And that issue is also resolved by this change. So you're now able to transfer into the right place any time of the day, regardless of what the wait time is. That does mean that sometimes the wait times can exceed 2 hours during different times of the day for SNAP related phone calls. Although if you use the callback features that we have, often what I've found is that the wait time is less. It's just predicting a longer wait time because there's people that don't actually wait the full amount of time. So I think when you hear a long wait time, definitely would take the callback, and then you'll get, generally speaking, a callback at least no longer than the amount of time that was promised, but usually it'll be shorter. And so those are the biggest change. And I see the comment in the chat. I guess I'm not 100% sure about that one. But I have tested the callback features several times myself over the past 2 weeks to make sure that I understand them. And we're, as far as I know, they're currently working. And you either will be able to schedule a callback at a specific time or just get a callback as soon as possible. And we're expecting later this month to be able to have a link on our website where people could actually schedule a callback directly on our website without having to call in at all. And that would be, for all types of different questions. So that's the biggest change that's been happening at OFI recently. The sort of plus side is that we are going to be, all of the clerical staff that used to answer phone calls and usually transfer you to somebody else, we're now going to be training all of those staff as main care eligibility specialists. So within the next month, we'll have 45 main care eligibility specialists. That's something we never had before. And it should make, we should see improvement in our ability to process main care only applications and renewals and to answer main care only related questions, since we'll have a dedicated workforce that will only be doing those things starting in October. And that'll be just in time for open enrollment. So you may not see a big change right away because we get like 10,000 applications for main care on the same day. That takes us about a month to get through. But by the time we get to January, most main care members should see the impacts of having additional eligibility specialists in our workforce. There are other changes coming up for OFI in the future with most of the changes that are related that impact clients that are related to the federal budget reconciliation bill are things that we will be implementing. I think as Michelle mentioned earlier today, the main care changes are really mostly at least 12 months away from now. There are some SNAP related changes that we will be implementing this fall. And as we get the dates confirmed for those, we'll communicate those with you, as well as through rulemaking and notices to clients who are impacted by those changes. So those are the quick updates that I wanted to share. I saw a question from Alex in the chat. The callback menu is not available in languages other than English. However, we do have a new option for people that need an interpreter to be able to request to say that up front, and then you go into a special call queue, which doesn't have, which means that we should be able to get to those calls without having to do a callback. The average wait time for calls with an interpreter is usually sufficient to do right away. But those are just for calls that need an interpreter. It doesn't really change the underlying need to get to somebody and then we'll get an interpreter on the line. It's just so that you don't have to have somebody who doesn't understand English listen to a bunch of menu options that are in English. This just gets them into the right, the best possible queue that we could think of, which is a SNAP trained eligibility specialist that can answer SNAP or main care related questions. If clients with limited English proficiency, have enough English proficiency to get, to navigate the phone menu, it's still preferable to do that. Even we'll provide an interpreter on any line that you land in. But it's definitely preferable to navigate the menu if you can, so that you get to the right spot. But if that doesn't happen and somebody goes to the interpreter option, we'll still transfer you to the right spot if it's not the right spot. I just wanted to clarify, it doesn't, like, being in the interpreter, pressing that button only means that you get to the same place without hearing more options. It doesn't really change how interpretation works here, and that we still offer interpretation for all phone calls, regardless of if you press that button or not.
I mean, there's another question just saying, how do they get to that option for the interpreter?
There's an option in the phone menu that it says, like, if you need an interpreter, press whatever the option is, and then that option is repeated in 3 languages in addition to English.
And I think it actually might be 4 languages, according to Vanessa in the chat, and it's option number 6.
I'm calling
Yeah.
the line right now to confirm.
Okay.
English is one of the options then, but English is one of the languages of the 4.
Oh, okay. Any other questions? Or were there any other updates? I'm sorry, Ian. Any other questions?
Yeah, I didn't have any other updates. Again, there's lots of stuff with federal changes, but for main care members, our advice is still that those changes are far out. People should continue applying for and using their benefits as they normally would, even if they're in a population of people that appears to be impacted, such as expansion adults who may be impacted by work requirements, or non-citizens who may be impacted by eligibility cuts there. But those are all at least 12 months away, and likely will be implemented at the person's next renewal date after the 12 months. So it's really not the only thing that people should really do right now, if they want to make sure that they keep access to main care, is to make sure that we always have your correct contact information, so that when there are changes that impacted you, that we can get you notice about those. But again, we're at least 12 months away from any main care related impacts, though there will be SNAP impacts sooner than 12 months.
And just a reminder for folks who are interested in thinking about how we can communicate about the fact that those changes don't go into effect for a year at least, both particularly with members or potential members, but also potentially for providers as well. One of the breakout topic areas that we're going to have a little bit later in this meeting, we'll focus on that. So if you have thoughts about that, please join that breakout. Any other questions for Ian? Ian, there's a question in the chat about
yeah.
the ex parte passive renewal system.
Yeah, that's a great question. So the passive renewal system, or automatic renewal system, whatever you want to call it, it doesn't go away with any of these changes. And so we still are automatically renewing something like 80% of main care members today. We expect that number will decrease in the future when, work requirements come into play, but we will still be automatically renewing as many people as possible. And then we'll be attempting, the law actually requires states to use automatic compliance for work requirements too, wherever possible. So if we can automatically renew people based on an exemption or based on knowing that somebody's already compliant, we will continue to do so. So ideally, there'll be a limited subset of the limited subset of people that are impacted who actually will face manual work requirement verifications. And we'll be working really hard over the next 12 months to automate everything that we possibly can to minimize disenrollments wherever possible as sort of the primary strategy. There's like two strategies. One is automation, and then the other is like partner outreach and communication. And by far, automation is our main strategy to minimize disenrollments associated with the new requirements wherever possible.
Thank you. There's a question about what happens, and this might be something that we don't have an answer to yet, but
Yeah.
maybe you do, about what to do when a doctor says someone can't work, but the government says they can.
I don't think we have enough info about that right now. I think there's like, if we're the part of the government that says that they can, that means you're going to get the notice. Like we are the ones that will send the notices. I would say for that, this is an area where we'll be working really closely to figure out what the opportunities are for automation, and then what the self attestation options are for these types of things. So this is the area that will be the most complicated, I think, to explain, is the people that might have an exemption, but we're not able to automate it. But as a reminder, it wouldn't include people who already qualify under SSI for main care, or somebody that qualifies under a disability related reason. Those folks aren't in the expansion population, so they wouldn't be subject to these requirements in the first place. Only expansion adults will be subject to the requirements, but we'll definitely be working on a lot of guidance about this once we receive guidance from the federal government. That's kind of the next step in a lot of the communication and outreach here, is to let people know how this is going to work in Maine once we actually receive guidance. But that's probably closer to this time next year when we would have a lot of that information. And that's why I mostly say people should largely ignore. Everybody that currently has main care will go through at least one more renewal of their main care without these requirements in place. So it's still pretty far down the road, and contact information and stuff like that will still be more important than necessarily figuring out how to comply with something that hasn't even been applied, and for some people might not actually get applied for more than a year from now, or could be close to 2 for some people.
Thanks, Ian, and a lot more to talk about for sure.
Yep.
Okay, well, let's move on with our agenda just because I'm conscious of time. I wanted to mention, although I actually just realized we are exactly on time, so that's impressive for us, I think. And we'll get a little bit of ahead because this is going to be a short update. So back in July, we had talked about finalizing the bylaws this month and voting on them, but we didn't get a lot of feedback or questions about the bylaws, which may mean that they're great and nobody has any thoughts or questions. But it also could be that it was summer in Maine, and folks are pulled in lots of directions and wanting to spend time with their kids or get outside, or they're working because of tourism season. So, or for all the other reasons. And so wanting to make sure that we didn't just assume that silence meant everyone was good with the bylaws. So we wanted to give folks more time for a chance to ask questions and have feedback. So we're going to take the vote on them at our next meeting, which isn't until November. And in the meantime, if anyone has questions about the bylaws or suggestions where they think something needs to change, please, and I'll reshare them out just so everybody has them. I should have put that in the agenda. I didn't think of it. But please do feel free to reach out to me and we can talk about it. We can share it with the whole list if needed. And I will share this out in a follow-up email as well, so everybody has this information, even if they're not here today. In the meantime, we do have a few minutes if there are any questions that folks have from looking at them. If you did take a time to look at them and then did have questions, but just haven't had a chance to ask yet. Okay. Oh, thank you, Kayla. Yeah, so Kayla just put the link to the bylaws, the draft in, up on the website and up on in the chat. And again, please feel free to reach out with any questions, and then we'll take a formal vote on this in November. And the way we'll do that, I will refresh my memory about how we did do one other vote, I think, since we've moved to Zoom. So that we had a way of doing it. I think we used a Google form or something. But we'll make sure that it's just for people. The most important thing is for any votes, we actually want to make sure it's just the MAC members, including the BAC representatives to the MAC, or alternates if the MAC member is unavailable. So we'll make sure that that system is in place for that meeting. Kayla?
Thanks, Kathy. I just wanted to check while I was searching for that link. I might have missed it, but did you mention the October MAC member only review or optional review of the bylaws?
I didn't. I meant to and did not. So thank you for saying that. The other thing that I wanted to mention is that since we don't have a meeting in October, and the BAC doesn't meet until 11 on that day, we thought what would normally have been our October, back in the monthly meeting schedule, our October MAC meeting, we thought we could have an open drop-in for folks to join. And if you want to look at the bylaws together, we can do that. I can go through them in more detail with you all, and then anyone who wants to join, and then that we can answer questions during that time as well. So you will see a calendar invite. I think it's going to come from me later today for that meeting, or maybe it's coming from Kayla. I forget what we decided, Kayla.
Sending it, but it's going to look like it's coming from you.
Okay, thank you. And so you're gonna get that for what would have been, if you're a MAC member, you'll get that for what would have been the October meeting time. And again, though, if that doesn't work because you've said, oh, I don't have a meeting on that date, so I already have something else scheduled or whatever, you can reach out to me separately and we can have a similar conversation. So don't worry if that doesn't work for you. And thank you, Kayla, for reminding me of what I meant to say. Any questions about that? Okay. Well then let's keep moving along. We have topical breakout rooms as our next item on the agenda. And we got positive feedback that this felt like a good way of giving folks an opportunity to participate in a space based on their interest. And again, there's another survey for us this month. So if you want to provide feedback on the meeting or on future agenda items, that's a great way to do it. So the 3 breakouts that we have for this month, one is the MaineCare rate setting process. And this is actually a continuation of the breakout room that was happening in July. But if you weren't here for the July meeting, don't worry, you can still join if that is your interest area. And then the second breakout is for provider relations folks. So thinking about this topic was submitted actually through the survey last month. Is MaineCare able to assist when providers refuse to see members? This is a significant issue when there are 4 major hospital networks and essentially operate the state's entire healthcare system and are geographically dispersed. And so the MaineCare provider relations folks are here to be in that group today and to talk about those issues. And then the last, HR1 communication needs. HR1 is the formal name for the budget reconciliation bill that Congress passed in July and was signed into law that we've already referenced today. And so this is our chance to talk with MainCare and OFI communications folks about what are some of the communications needs. And I will also note that like part of the intent of this is to think about further out, like what are some of the needs people will have as those changes start to go into effect, but also recognizing that there's been feedback from people who are MainCare members, from some providers, and also from like organizations like Meaningful Justice that work with people, that there's a lot of confusion out there that folks right now think the changes have already happened. And so, as Michelle mentioned, might be afraid that they're not eligible anymore and just assume that they're not eligible, and are not applying when they could, or may not go through the renewal process when they should. So we want to make sure that folks who are eligible get the coverage they need, and that people have good information about what's happening. So any questions about those breakouts? And thank you for putting those in the chat as well.
Problem.
Okay. Kayla, I'll pass it to you.
Okay, I'm about to open the rooms. You'll see breakout room number 1. You won't do anything. You'll just stay put in this main meeting room. Breakout room number 2 will be the MainCare Provider Relations and Engagement. You would choose to opt into that breakout room. So then you'll leave this room and join room number 2. And then room number 3 is the HR1 communication needs. And same thing, you'll opt in if you want to join that one, and it will take you out of this room into that 3rd breakout room. I'm going to go ahead and open the rooms. I'm going to be in room number 3. I'll be a little delayed in joining you all because I'm just going to make sure everything's sorted here before I hop over. And it looks like it's working. So if you're having an issue at this point, raise your hand and I can help troubleshoot, but I see folks are joining. Mitch, what are you seeing on your screen?
I'm not seeing anything on my screen.
Oh, okay. Okay. Do you have a little button on the menu that says breakout rooms by any chance?
Yes, sorry, there it is.
No worries, no worries.
All right.
And Rhonda, it might be showing up under more. If you have a button that says more that you can press, then you might be able to select breakout rooms from there.
I don't have a button that says that. I do have a thing that shows I can leave, but does that mean I leave altogether?
Yeah, we don't want you to leave.
No. Okay.
So there should be a menu or something that says breakout rooms that you can click.
Rhonda, I can manually put you in. Which number do you want to go in?
I think she left, yes?
I think she did.
All right.
Wait, I'm gonna go ahead and hop over to my breakout room. Kat, would you
Okay.
mind closing these into, I think we could go 23 minutes.
23 minutes, sure.
Yeah. Okay, thank you.
Of course.
Okay. So everyone
Hello.
that's still here should be here for the rate reform website overview, I hope. Okay, so my name's Amanda Lee. I'm the rate setting coordinator for the Office of MainCare Services. I'm just going to share my screen. Sharing is not turned on. You can request sharing of this meeting. Okay.
There you go.
Okay. All right, everyone should be able to see the website that says MainCare Rate System Reform. Okay, so just going to apologize up front. I do go kind of quickly. I'll try to slow it down. I'm going to bounce around a little bit because the website for me seems to make sense, but basically you have, our goal at the top of the page, clear and transparent processes. Then here, there's a link to the actual MAC page, which brings you to the MAC page, but also the rate subcommittee meeting information, which relates to this page. And we are making updates to this page on a regular basis. So here you have, what is a rate determination process? What does that look like? The phases of a rate determination. There are 5 typical phases. That information's here. We have a flow chart. If you click on this, I don't know if it's going to share it if I open it. Yeah, it does. So this flow chart shows you the required notices and collaboration with providers in red, and then additional ones that we send out in the black. This is really helpful information to see the flow of a rate determination, a typical rate determination. There's also an ordered list here. And then the actual rate determination schedule is going to be in the in progress and upcoming. So right now we're working on calendar year 25. So everything in here is what is currently in progress. It'll be the section of policy or the name of the service. Sometimes it's a new service. We'll put all the notices here, like e-notices. Make sure you sign up for any that you're interested in so you can get, invitations to kickoff meetings, public forums, and presentations. And then here is where we would put all the presented materials. And then over here, we have the rationale for conducting the rate determination. If it's one service, all the services in a section. Effective date is usually to be determined until the end of the rate determination. And then if anything is needed, or when their next rate adjustment is, not rate determination. And then if the section needs anything more, like did we look at one service or did we look at all the services? And a better example to show you what I mean is once it's done, we move it down to completed. So we'll look at some of the completed ones. It has the rationale, it has the services, and the effective date, like this one's pending policy adoption because it's new, or we made so many changes to the methodology that it requires rulemaking, basically. And then the next rate adjustment, whether it be a cost of living adjustment or whatever, is still to be determined because a lot of that rides on the effective date of the finalization of all the work that we did, which is done through the policy adoption process. And then further section change needed for this one would be none because basically they pulled this service out, I think, of 65. I think it's supposed to actually be its own section. So it would not need further section change, but it would every 5 years. The rule is every 5 years we look at the services. And so you'll see all of the stuff that we've already done in here. And anything that you guys have questions on during or after, feel free to send me emails. I don't get questions very often about the website. And I would love to be able to help people. So if you have any questions, please reach out. Then we have the schedule of past COLAs, cost of living adjustments, and services that are aligned with Medicare standardizations. Sorry about that. These are all notices that have gone out in the past. And then at the bottom of the page, and this is kind of backwards and going back to the background of how we got to rate reform, that information's here. The comprehensive rate system evaluation was done through a vendor. They basically helped us identify where things needed to be looked at the most in the beginning when this all started, like which sections it helped us build our priority list, I guess, from the beginning. And then it goes into the rate reform law that was the result of that comprehensive rate system evaluation. And then down here, it talks about the annual process of determining which sections we're going to look at next. All of our past materials are here. And we have an email that I'm going to put in the chat after this, where we're accepting feedback all year round on what you feel needs to be looked at next, whether it's a service or a whole section policy. And so I'll put that in the chat. I'll put my email in the chat. Trying to give you guys a quick overview before they cut us off. And then at the bottom here, this is really a work in progress, is the frequently asked questions. We're still working on posting the frequently asked questions that are actually related to rate reform. But we have some here that are related to some of our prior rate determinations. And then this is regarding the service provider tax that was effective, I believe, in January. So that's the website in a nutshell. If you have questions, anyone have questions right now?
Amanda, can you put the link in the chat so we can open it up even after?
Yes, that might have been probably the best thing to do. And then you guys could have poked around in there while I was going over it.
Well, I'm glad it. It's nice to have the tour.
Right.
In case
There,
I cut off, I want to know how to get to it.
And then the rate reform email, I just want to double check because sometimes I think it's rate.reform, but I think it's rate reform. Yeah, it's ratereform.oms. So ratereform.oms@maine.gov is the email to provide feedback. Feedback on a past rate determination, or to provide suggestions for what you think needs to be looked at next and why.
Man, thanks for going over the webpage. I think it's laid out really well, and I've accessed it often. It's a good quick reference to grab good up-to-date information. And this might be off topic and not relevant to this specific topic, but I was wondering about the value-based purchasing initiatives. And maybe that's a suggestion for a different breakout at a different time. But if the department was focused on adding any sections of Maine Care, or where the work was in that process of meeting the benchmarks and goals of a certain percentage of Maine Care reimbursed services participating in one way or another in a value-based purchasing environment.
Right. So basically, where would we put that information, or are you asking where are we in that process?
Where's Maine Care in that process?
Right. I don't know off the top of my head. I can find out for you, but I'm wondering if we went over it during our last TAP presentation. I think we might have, but either way, okay. I know that we've done quite a few sections, and with every rate determination, that's something we look at, whether or not we can do value-based purchasing for that service. But yeah, I'll definitely find out for sure the numbers or the percentage, but I think it's pretty high if I remember correctly.
Okay. Excellent. This again might be a little bit off topic and specific at the same time. Section 106, I just wanted to see maybe where that was at, if there's any updates. Megan,
so section 106, so still internal planning, meeting with the vendor to establish the initial timeline. And I think they're working on a survey with the vendor. So I believe it'll still be a few more weeks before they're ready to kick it off. There's discussions. I believe we've decided that they're gonna have two separate tracks because it's 65 MDFT services as well as 106 that we initiated together. But I think that they're gonna have separate tracks.
Okay.
So not sure if the kickoff will have both services or if we're going to do two separate ones, but they're still working through some of that.
Okay, and that's to determine the rate for the new service. And do you know if, I think it was the last I had heard, it was with the AAG and getting approval and sign off, and I think Maine Care and you all had done everything you needed to, but just getting that final go ahead. Do you know if that has happened?
For 106?
Yes.
I'm really not sure where that's at.
Okay.
Maybe I could check with Kristen. But I think it's still on track to, yeah, I'm not sure. I'll have to
Okay.
double check. I don't want to give out the wrong information.
Okay, all good. Thank you.
You're welcome. And thank you for your feedback on the website. Just so you guys know, I am going to be making updates to the page eventually here. There's a lot going on this summer, you know, with budgets and everything. But hopefully moving some of this stuff around so it flows better. But yeah, if you have any questions, please reach out. It's amanda.lee@maine.gov. Any other questions? And then I don't know if you guys know this. Well, you probably do. You've probably been on the Maine Care Advisory Committee page. We have the rate system subcommittee that meets monthly as well. If you want to know more about, you know, in the details or in the weeds of each of these rate determinations, or want to follow along with the process more, you're welcome to contact Laura Cortez. She's the chair of that committee, and she can, you know, maybe you just want to pop in and see what we're going to talk about that month or whatever. She'd be happy to, I'm sure, give you that information so that you can pop in and see where we're at.
This is great information. Thank you very much.
You're welcome.
We do have about 9.5 minutes left. So if people do have questions, definitely raise your hand or come off mute.
And Mark, your question specifically on 106, just so I have it right, you're basically asking about the rule, the policy of the 106 and where that falls, when we think that's going to come and be effective, basically.
Yes, and also, I mean, yes, that was my original question, but the rate piece also obviously important. And yeah, that was the.
Yeah, I know there's been conversations in the past about the rates being available before the service is adopted and trying to align so people understand the rule and the regs as well as the rates at the same time.
Yeah.
So I know that as the department is trying to align those two things with all of our work. So
Okay. Then I believe it's needs to go through since it's major substantive to the legislative process. So
yeah,
I'm assuming we can anticipate that next session at some point.
Yeah.
For the policy and the rates. Okay.
Yeah,
Great.
that's what I would expect too.
Great.
So if you were to summarize what the rate determination and everything were for somebody who isn't familiar with the process or isn't familiar with the website or how to navigate, if you were to explain this to somebody outside of the MAC, for example, a MAC member or even just a regular member or caregiver of a member, how would you summarize all of this work? What would you say you do, and what would you say is your main goal? I know from working with you guys, but if somebody were from the audience that didn't know and didn't want to speak up, I just want to kind of have that little summary, especially using the 7 minutes that we have left.
Right. I would say that the rate determination process is a process that includes collaboration with the public and providers for fair and data-driven reimbursement, equal reimbursement across sections. So you're not, you don't have one CNA under one section that makes this and one under another makes that. Basically, it's data-driven. We look at national and other Medicaid reimbursements, so things make sense, are fair. But yeah, data-driven. We want to try and improve quality at the same time. It's basically just a more collaborative process to ensure that the reimbursement's fair, equitable, has quality built into it, and better outcomes for members.
Great. Thank you so much.
You're welcome.
And for the backside, not exactly a pun intended, but what would you see the collaboration be between the BAC and the rate setting committee?
That's something we've been trying to work through, but I think, you know, providers, they have the business side of it. They know what the cost is for providing the services, and the members are really coming at it from personal experience. So I think it would be good to get their input on services and access to services, things like that. And I know that we're trying to work through when it would be best to get that feedback. Because like I said, we're accepting suggestions for rate determinations. We're also, you know, have public forums where we present draft rates, where that might be, some of it might be over the head of a, you know, person off the street that doesn't run a business, especially a medical business. So I think that, yeah, I think that personal experience will probably be the most important feedback. And then I know some of them work for advocacies too. So
yeah, that's wonderful.
Access.
Great. If you ever have any questions that you'd like the public or members to weigh in on from the BAC, feel free to write up some questions, send them to me. I could pop my email in the chat. And then I could always bring them to our BAC members and see what we can come up with, ways to collaborate. So,
okay, awesome.
Just wanted to give you guys a 3-minute warning. We will be closing the breakout rooms momentarily. So if you have any last minute questions, definitely raise your hand, come off mute. Did everybody have a nice weekend? Since there's crickets going.
I did, and I'm going to be going camping by myself apparently this weekend because I booked one last camping trip and everyone's busy. So I think it's going to be me and my dogs.
Good company.
Yeah. They don't argue or anything. They don't ask for much.
Fair. So where we are in the main room, I'm going to keep us all here, but you'll see people start to trickle back in. I'm going to broadcast, letting them know that we have just a few more moments.
I would say, Amanda, and share that in addition to having a predictable system that we can all organize around, the COLAs have just been a huge feature of that. And I know that there's fiscally been some little bit of challenges there, but it has just been from the provider planning predictability side, it's just really been incredible to have that part of the system.
Yeah, I definitely see the benefit of that. And I mean, I think we all can use COLAs from time to time. The economy the way it is, and you know, the minimum wage increasing each year. So.
And even the whole rate reform system, I mean, that was a huge amount of work for you guys to sort of build that from the ground up. And feels like the days are not that long behind us when it was just sort of everybody arguing for rate increases, and whoever had the loudest voices got the attention. So it's really amazing to have an organized system for it, and no small task. So
no,
right, yeah, a lot of work.
Yeah,
major applause. Very good. All right, folks will start trickling in. They just got their warning and hopefully we'll get the ball rolling as soon as possible. Thank you everybody for a great conversation. And Amanda, thank you as always.
Thank you.
I see folks coming back. Thanks, Shannon. Yeah, we had a great discussion in room number 2, and we'll share our notes. And hopefully, we can share our notes from the other 2 breakouts as well. I realized that we normally have space in the agenda for subcommittees to share updates. And I did not think to put that on this month, and I apologize for that. I did just want to know, so we have a little bit of time, we're a little ahead of schedule actually. So let's take a minute to touch base about those things. One thing I want to note is that we still do not have a vice chair of the MAC, which is someone who's back up to me for scheduling the agenda and things, and also facilitating the meeting. And then we also used to have a provider subcommittee that met to specifically be able to dig in on issues that sometimes are really in the weeds for providers, and may not be most suitable for a big MAC meeting, but was still like a helpful space to address concerns that providers had. But we don't have a chair for that subcommittee at this time because the person who was the chair retired now over a year ago. So it's been a while. So if there is someone here who's a MAC member from the provider side, please consider being a chair of that subcommittee, and we can get it restarted again. And again, remember, a reminder that you don't have to be a MAC member to serve on a subcommittee, but we do ask, or to be a part of a subcommittee, but we do ask that the chair be a MAC member. So that's why I'm saying that out loud. And then we also do have a rates subcommittee, and I'm guessing some of the folks were in that breakout room today, but I know Laura is not here. But Mark, is there anything that you want to lift up? And it's okay if not. Mark Eves is.
Yeah, thanks,
here
Kathy. I'm pitching in for Laura, who's taking a well-deserved vacation. I don't have a whole lot to add. I can pull up her notes here in a moment of the last meeting, but I think the bylaws were referenced, and let me take a peek at it and see if there's anything relevant for the group. And report back.
Great, thank you so much. And from the dental subcommittee, we did have a meeting this summer, and a lot of our meeting was actually focused on HR1, the budget reconciliation bill, and its impacts, because folks had a lot of questions on like who is impacted and what will that mean, and from both a member and a provider perspective. So we spent a lot of time discussing that at our last meeting. And I realized, because I didn't have this on the agenda, I don't have my notes in front of me, but if there's anyone else from that subcommittee who wants to lift anything up, please feel free to raise your hand. I know there's a couple folks here. But appreciate continuing to have a space where that can be a focus. Any questions about the subcommittees?
Kathy, I'll just note that the next meeting for the subcommittee, the rate setting subcommittee, is September 29th at 2. for anybody that would like to join. And I think the only probably most relevant is regarding the bylaws. It was raised that Maine Health Care Association actually be a member. So I'm not sure that had been reported back or out or up or wherever that might need to go, but that was a suggestion that made it into the notes.
Thanks, Mark. And we'll make sure Michelle Probert actually does the nomination, the appointments to the MAC. So we'll make sure that she has that feedback. I think the feedback was that that was the only big provider association that doesn't have a formal member on the MAC.
Okay.
Thank you so much. And I see that Amanda Lee shared information about an upcoming public forum for specific parts of Maine Care policy. So the NF specialty units, and then also the HCBS 18, 20, 21, 29, and new lifespan waiver sections. And for those who are not as familiar with Maine Care policy, like often you'll see us mention like section 25, for example, which is dental. Those are different parts of there are different sections of policy related to the laws and rules around Maine Care, and they all have different topic areas.
I just put the link to the actual site where they can go and see which service. Yeah, this is kind of confusing. And just to clarify, those two links that I just posted are invites. There's Zoom links to upcoming rate reform work for those services.
Perfect. Thank you so much.
You're welcome.
And before we do our last agenda item, one other note, and I think I said this in one of my emails, but just to flag that last month during, it was in the notes and the agenda. Last month we had a breakout around policy that folks were able to join, and it needed more time, but the folks on the policy team at Maine Care decided that maybe instead of having it be another breakout, that it might be more helpful to actually do a survey of MAC members to get more information about how to make that part of our meeting work better for everybody. Policy being like the rules around how Maine Care implements the laws that they're subject to. So we will share more about that when the survey is ready to go, and I'll email that out to everybody. And then also just to make sure everybody saw in the notes in the agenda that there was also a request around non-emergency transportation and to be a topic again, which we have had several times in the past. And the team from non-emergency transportation can actually join our November meeting. So we'll have more at that meeting about that. All right. Mark.
Thanks, Kathy. Just a quick question about the HCBS waiver service updates for 18, 20, 21, 29. Do we need to register for that, or just put that in our calendars and click the link that was posted?
I don't believe you have to register for that one.
Okay.
No, I don't think so.
Okay, great. Thank you.
Welcome.
Kathy, just to note, anybody that has an appointment or is being treated for cancer through Maine Medical Center's Maine Cancer Program, they have free transportation. They just ask to speak with the navigator or the, licensed clinical social worker at the practice. So anybody with cancer or receiving cancer treatments or appointments does have free transportation.
Thanks, Rhonda. And I'll just note in the chat, there's a question from Rachel about the people may have seen that Motive Care is filing for bankruptcy, and they are the vendor that is doing the non-emergency transportation for the state, and wondering if there's a contingency plan or how does that affect people. I know we're going to talk more about non-emergency transportation in November. I think for now, the actual filing of the bankruptcy does not impact people's access to transportation. And I see Kayla nodding her head, so hopefully that's right. Kayla, is there anything else you want to say about that?
Yes, so member access to transportation is not affected, and the department is aware of the bankruptcy situation and in close contact with Motive Care, so staying up to date on all of the stats and how everything's going, and there's been no disruption, and we don't expect any disruption. We are working on a member-facing e-message to put this out more broadly, so that folks, given everything in the news, can be reassured about access to transportation. Folks should be still continuing to schedule their rides. They should plan on having rides that have already been scheduled without any disruption.
Thanks, Kayla. And I think that that communication will be really helpful. Sarah.
I should know this, but is transportation for cancer patients available regardless of immigration status? In other words, it's for someone who claims residency, like they have what if they're living at the shelter? That's their home address here in the state of Maine, and they're an asylum seeker, so they don't qualify for MaineCare. Do they get to have, and they have cancer, do they have free transportation?
Yes, the Maine Cancer Program, it does not matter if you have insurance, if you don't have insurance, or what insurance you have. It's completely covered if you're getting any kind of cancer treatment.
Okay, thank you. I just wanted to double check. Thanks so much, Rhonda. Good to see you.
All right, well, so that brings us to our last agenda item, which is really just a few more logistical things related to the MAC. So one is that beginning next July, we need to have an annual report that we will have to share out, post publicly. And so we want to start thinking about the plan for that report. And related, we also need to have 2 public meetings each year where folks can bring concerns or comments to MaineCare, to the MAC, and that we also then need time to respond to those things that are brought up. And so tentatively, our plan, Kayla and I spoke about this, trying to figure out scheduling wise, just trying to make sure we're compliant with the new, these are all parts of the access rule that also helped create the back. To help to make sure we're in compliance with that rule, that's a federal rule. We were thinking of doing one of those meetings in January, and one of those public meetings maybe in April, with the hope that we'll be at the end or finished with legislative session for folks who are very tied up in that, which includes myself, and have a little bit of, and that would still give us some time to work into the report anything from those public meetings. And then we were thinking that one of those public meetings, for both of those public meetings, we would definitely have a virtual option, but we would definitely want at least the April meeting to be in person as well, so folks could have an option to come or not. And we are going to spend some time in our November meeting thinking more together about those public meetings, and thinking about like what role will come prepared for the November meeting with a proposal that folks can respond to, like in advance of the meeting, that folks can respond to. But thinking about like what roles do we need filled in order to make those successful? How do we manage the responding to people's comments? And then also a draft plan for doing the report, again, with roles and opportunity to have folks engage in that process. And this will also be coordinated with the BAC. And of course, we have BAC members here today and we'll have them going forward, but wanting to make sure that we're not doing this in a vacuum, that we're also getting feedback from that group on how to make those processes effective. And if the public meeting for the in-person option around the public meetings, I believe we haven't actually discussed it, but my guess is that we would do it in Augusta, probably either at DHHS or maybe in the Cross building. Sometimes we've held public rulemaking sessions there, for example. I know I didn't give any like specific details, and I said we'll talk more about this in November, but any questions or anything that anyone wants to flag as we're thinking about the draft to share out with you all? And I'm also thinking one thing that we should consider is interpretation and like what that might look like for those public meetings as well, so that folks with language access issues of any kind are able to participate fully. All right, not seeing any hands. So I'm going to talk some more with Kayla, but also if you have additional thoughts between now and say mid-October about what either of those things could look like, either the public meetings or the report, please feel free to reach out to me. I'd love to hear your thoughts. And then I'll also make sure we have it enough in advance that you have some time to look at it before the November meeting. And then just remember that we will also have, you'll see a calendar invite for October, the first Tuesday in October, from 10 to 11 to talk about bylaws and go into more detail about those. And is there anything else that anyone needs today?
I will ask everyone to please take our post-meeting survey, which I'm going to put in the chat now.
Thank you. Yes, please do that. And I'll share it out in an email a little later today as well, but try to do it now so you don't forget. Since we're ending a few minutes early, that means you have time to do the survey. Thank you all so much for your participation, and I hope you have a good rest of September, and see y'all soon.
Thank you.
Thank you, everyone. Bye-bye.